Good morning, Nurse.org. I am so excited to be here today. I'll actually be here today and tomorrow. And we did 2 days because I have kind of a hybrid role. I do both telehealth and I do in clinic. So today I'm on telehealth, so we can talk about that a little bit and I can talk to you about my role. And then tomorrow I'm actually seeing patients all day in the clinic. So I'm Monica Elston Carter. It's so nice to meet you guys. Again, I'm just so excited to be here. I'm a family nurse practitioner and I work in obstetrics and gynecology in Washington, D.C. And I think the most common question I get is, why F&P if you want to work with women, and how did you do F&P and get to stay in obstetrics and gynecology? So we will definitely talk about that because that's a popular question. Prior to becoming an NP in obstetrics and gynecology, I was a labor and delivery nurse. So I got it honest. I've always wanted to work with women. That's truly my passion. While I'm with you guys for the next couple of days, we're going to talk about a typical telehealth day for me, a typical day in the clinic, what I see. So I told you I'm in obstetrics and gynecology. So what do I see? Everything you go to your gynecologist for, that's what I see. I also see women throughout their pregnancy. So I'm seeing new pregnancy appointments. I'm doing their counseling, their teaching, seeing them through the pregnancy, managing high risk and low risk patients, coupled with our maternal fetal medicine specialists, which are high risk doctors. I'm seeing women for all their gynecologic needs throughout the lifespan. So I love it. I also get to do procedures. So I think that's a really cool part of OBGYN. You have the pregnancy side, you have the GYN side. We have acute visits like UTIs and STIs and breast pain and pelvic pain. And then we have procedures, which is great. I insert IUDs and Nexplanon, do endometrial biopsy. We have colposcopies, vulvar biopsies. So it's a really cool specialty because you're always learning and there's always something new to kind of keep you on your toes. I have telehealth today, so I'm going to be starting with my first patient in about 5 minutes. I do a really cool thing also as an NP, and this is an additional service called hereditary breast and ovarian cancer screening. So for patients who have a personal history of breast and ovarian cancer, or a family history of breast, ovarian cancer, uterine, melanoma, colon, gastric, it's a long list, prostate, pancreatic. We do counseling for them, and we actually do the order form and everything like that, and they can get the saliva or blood test. This is a really common question. My personal opinion is that new grads should start wherever they want. New grad nurses can start in a specialty. New grad nurses can start in ICUs, NICU, postpartum, L&D, GI, HEMONC. Or yes, med-surg. Med-surg, you will learn a ton. And the reason that it's outdated, I will say it's outdated advice, but the reason people used to say start in med-surg is because it gives you the basis for nursing. You take care of sick patients, you take care of really every kind of patient, and you'll learn really just a ton of nursing skills. That said, there are people who know they want to be in the ICU. They know they want to do women's health only. They know they want to work with kids. And you, as a new grad, should start in a specialty. I'm so glad someone asked this because it brings me to my next point. Advice for new grads wanting to start in a specialty. Number 1, look for academic institutions. Look for teaching hospitals. Those are hospitals connected to a university like GW or Georgetown. Or next, scope out the new grad day. I actually had my labor and delivery nurse job when I was still a senior in nursing school at Hampton University. So I actually drove to my dad picked me up, but drove to DC, did the interview, and got the job before even graduating or passing NCLEX. Next part of advice, look at nurse residency programs. Places with nurse residency programs are more likely to put you in the specialty that you want or expose you to multiple specialties so that you can figure out what you even like. For those of you who want to start in a specialty, keep an open mind. Be open, because there are so many specialties that I'm like, you know what, I could have done PACU, like I could have done OR, maybe I could have done that. I'm definitely not an ER and ICU nurse. I'm just not. Through the nursing tract, you can only deliver babies as a certified nurse midwife, CNM. If you do a dual program, which has women's health NP and CNM, great, you can deliver babies. If you're just F&P or just WH&P, you can't. It's super common. I have friends working in transplant, GI, interventional radiology, neurology, ortho. I have friends working in peds transplant, peds cardiology. Very, very common for F&Ps to work in specialties. morning, Nurse.org. I am walking into work today. I got my Dunkin', and like I told you guys, I have 19 patients today. I am on Georgetown's gorgeous campus. For anyone considering coming here, it's absolutely stunning. And let's just get into it today. Guys, so I'm on lunch break, and after, my first patient is going to be an IUD removal and replacement. So these are some of the instruments that I'll be using. There's a speculum. We use a bit of a wider speculum for procedures. We're using a Mirena IUD today. The consents are back there for the patient to sign. The consents are back there for the patient. If you have asked if you can work as an LPN or an RN in the outpatient setting, and the answer is absolutely yes. We have LPNs that staff our floor who do nurse education, they do nurse injections, they have their own schedules. They also assist the nurse practitioners and physicians in the clinic and in the rooms. They room patients, they do vitals. They're a huge part of the team. We also have LPNs in our triage area who take phone calls, they take messages, they advise patients, they triage patients, and send them to the ER or send them to labor and delivery, etc. And we also have registered nurses in our office who also work on the back end, our nurse managers and RN, and we have registered nurses who oversee the rest of the clinic. So you can work outpatient as an LPN or an RN if inpatient isn't for you.
Okay, and we always going. What a what? What a money reside. What a money reside. What a money reside. What a money reside.
My takeover is coming to an end soon, but I want you guys to send any burning questions you have, and I'll still answer them this evening. And I promised we were going to talk about negotiating, and we will.
Four, three, two, one. Level up, level up.